Hi Sam.
Hello David.
How you doing? You all right?
Yeah, very well, thank you.
Good. Would you like to introduce yourself?
Yeah, my name's Samantha Harris-Fox, otherwise known as Sam, and I'm presently a lecturer in nursing on stage 2 of the adult nursing programme at the University of Derby.
Lovely. Do you want to tell us a little bit about your career to date?
Yeah, okay then. So I did my nurse training in 1992, qualified in 95. I initially worked in coronary care for a year when I qualified, and then I went to work in intensive care, adult cardiac intensive care, and I worked there from sort of 1996 up until 2 years ago in various roles, initially as a staff nurse on the adult cardiac intensive care. Then I went to work in a specialist role as a research nurse for paediatrics and adult ECMO, and then I did a specialist role for sort of 18 years as a band 7, which meant I worked in both adult and paediatric cardiac ITU.
So what made you want to go into nursing in the first place?
You know, that's a really funny question, because we ask that all the time when we interview candidates for the course.
Yeah.
And quite often, I think my reasons at the time are exactly the same as a lot of our candidates were. I grew up with members of the family who were nurses, so when you've grown up being kind of surrounded by stories about nursing, it's kind of a very normal sort of part of your kind of daily kind of conversations. But it wasn't something I particularly wanted to do until I was about 16. I was very musical and was thinking about doing sort of music at university and, you know, possibly teaching or performing arts, because I was also a dancer. And then as part of voluntary work that was organised at school, I went to work in a residential home, and it was one afternoon a week, and it was just one of those things where you went in and talked to the residents. And I really enjoyed that. And then because I started thinking about maybe nursing, I did some voluntary work at our local general hospital in Ash, and I suppose I love the whole professional side of nursing, and the very sort of a lot of people talk about, you know, loving the people in the care, which I did, but I really like that sort of being able to assess patients and doing observations and talk about planning what care they need. And so that's really what just made me want to be interested in nursing.
Okay, so what prompted the move into lecturing?
I'd always loved working with student nurses, and I think for myself as a student nurse, I always remembered the mentors that I had that really inspire you, because they just, like, I remember them now, 2 in particular who I felt that was the sort of nurse I wanted to be. Sort of 6 months before I decided to apply for the job, I had a pre-reg master's student from Nottingham who was put to work with me, and I just absolutely remembered how much I liked working with students. She was so interested and really, really, you know, keen to learn and keen to know more about the specialist area I was working in, and it just made me think, actually, I think this would be the next move for me. Okay,
if you weren't a nurse, what would you be doing?
I think I'd be a judge on Britain's Got Talent.
And what qualifies you for that?
I just think I'd be good at it. I think I was meant to be famous, to be fair. I'm not really sure doing what. So maybe I would have gone down, you know, the Big Brother route, one of those programmes, just to get my 5 minutes of fame.
I don't watch any.
No, I think if I hadn't decided to go down the route of nursing, one of the things I was really interested in doing was music therapy.
Okay.
But sort of like in the early 90s, when I was looking at you know, different career options, it was really, really hard to get into. There was, I think, the only place you could do it was one of the universities in London, and it was really, really competitive to get into. So I suppose if, like, I had my time again, or if I was changing career now, I'd probably look at something like that.
Okay. Are you still musical? What are your hobbies and interests outside of work?
I am still musical, but only on my own. That sounds a bit strange. I used to play up until about 10 years ago. I still played saxophone in a band, but when I had my 3rd child, it just got really difficult juggling working and finding childcare to play in a band. So now the only thing I do is play piano for my own sort of interest. But other hobbies are very sort of fitness related. I used to, and that links in with one of the questions, I don't know if you were going to ask the question about how you kind of deal with stress and positive coping
Go on,
strategy.
You're going to tell me about it.
Yeah, I've always found exercise really, really important for that. I've always exercised. When I was younger, I was a dancer. Always gone to kind of whatever in aerobics class was in at the time. And then about sort of 10 years ago, I got into triathlons and running. I did the London Marathon in 2015 and then decided I was never going to run again. So since then, I've done very much yoga. And my new hobby, which started last summer, is stand-up paddleboarding, which I do as part of the yoga studio I go to. Learn to paddleboard and regularly go paddleboarding, obviously not at the minute, and also do yoga on paddleboards as well. So very keen on that.
So if you could meet anybody, who would you meet and why?
I've always liked Peter Andre. Do you know Peter Andre?
Do I remember Peter Andre?
Yeah. No, well, he's a guilty pleasure because he's not the brightest, but there's just something really nice about him. But I would, and this is going to sound really, really corny, I'd really love to meet Oprah Winfrey.
Okay.
Yeah, just because I think she's really, really interesting person, and there'd be absolutely loads to talk about and lots to learn from her. And she might be able to get me my job as a judge on America's Got Talent, if not Britain's Got Talent.
Okay. Well, I think our conversation seems to have summed you up, Sam. I've learned some new things about you that I didn't know before. And hopefully our students will know you a bit better as well.
Okay.
It's been brilliant talking to you.
Thanks, David. Bye.
Bye.